Coming up on Why Should I Trust You? The midterm elections are around the corner, and healthcare is shaping up to be a central issue. We're talking about, yes, the rising cost of care, expiring ACA subsidies, and potential cuts to Medicaid, but we're also talking about nutrition, school lunches, ultra-processed foods, pesticides, and yes, vaccines. This isn't the old for or against Obamacare debate. The political lines are scrambled, and MAHA sits in the middle of all this. As one political analyst put it, healthcare policy is going to be a top issue in all competitive House races this cycle. So at a time when Americans are really worried about affording daily life, how do health and healthcare costs fit in? How do we as a nation feel about MAHA's nutrition agenda? Where are we on pesticides and pollution? Is that something that's really going to take us to the polls? How about the changes we've seen to childhood vaccine recommendations? So today we've assembled a team of pollsters to take us inside the numbers. And we're going to be joined by a good friend of the pod and supporter of MAHA. We have a lot to cover, so let's get started. Hey everyone.
Welcome.
So we're talking politics today. We are psyched to have these guys on from KFF and Navigator, plus Aaron from MAHA. They do such important work. It's like a Pollster-palooza today. Not a pool party, but a poll party.
Oh, Brenda.
I had to. I'm sorry. I was thinking about that one, guys. I planned that one in my head. But first, who are we? I'm Brenda Adhikari.
I'm Tom Johnson.
I'm Maggie Bartlett.
Yeah, and Dr. Mark is off this week. And this is Why Should I Trust You, a podcast all about the breakdown in trust in public health and medicine and science. And as you know, we look at that issue entirely through the prism of polling data. Always. Never.
Yeah, but we do love a good number or two, don't we, on this show? And here's a number. We're only 7.5 months away till the midterm elections. Wild. Time is flying. And it appears that health, especially affording health, is so front and center right now. I mean, Trump himself has talked about centering these issues in his push for Republicans in these midterms. So to help us crunch these numbers, we've got a crew from KFF and a research analyst from Navigator, as well as our great friend from the pod and MAHA supporter Aaron Everett. Look, we did an episode like this, a few months back along with Navigator. And it's clear that the country is thinking about health right now, Tom, and we want to understand what we know, what we don't know, and what we can expect for the next several months. So let's just, Tom, set the table for us before our guests join.
Yeah, very briefly, because it's a whole episode of setting the table. But, between now and Election Day, there's, as you said, about 7.5 months until Election Day. And Americans will make an estimated 500 million visits to the doctor.
I just made one.
Yeah.
I'm one of them.
It's an amazing that we tabulate how many visits to a doctor that Americans make each year. But we got about that many left between Election Day. And for a lot of Americans, as we know right now, whether or not they can make that trip to the doctor is becoming an open question. Affordability is so on the minds of Americans right now. And it's a worry that pollsters say, Americans will bring with them as they head into the voting booth or fill out those mail-in ballots this November. So since 1999, health insurance premiums have risen at 3 times the rate of wages. And according to a recent Mercer survey, Americans who get their insurance through their employer, which is the largest bucket of coverage, just experienced the biggest cost increase in more than 15 years. For the roughly 7% of us who buy insurance on the ACA marketplace, costs are projected to double this year, and that could mean paying thousands more for health insurance. And of the folks that buy on the ACA marketplace, about 1 in 10 have already responded to these increases by dropping coverage entirely. So, for nearly 20% of Americans covered by Medicaid, and that number is expanded significantly under the ACA, we know that reductions in spending are coming. The One Big Beautiful Act, which was passed by the Republican Congress and signed by President Trump, is going to push through tax cuts, but it's also going to reduce Medicaid spending. Many of those changes will take effect after Election Day, but that is hanging over people now. All of this helps explain why the share of Americans calling the cost of healthcare the most urgent health problem the country faces has climbed to 29%. And that's one of the highest levels since 1987. That means Americans are saying it's a more urgent health problem, the cost of care, than obesity, than cancer. 70% of Americans now tell Gallup that the health system is either in crisis or has major problems. So Democrats have traditionally had an edge on the issue. President Trump and Republicans, along with, they hope, the MAHA allies, are trying to blunt that advantage this time around. But time is short, and voters are heading to the polls deeply worried about the state of our healthcare.
Okay, so with that, it's time to bring in our team of pollsters to help us make sense of where Americans stand on all this. Coming up next, we're going to be joined by pollsters from KFF, Navigator Research, and our good friend Aaron Everett. We'll be right back. All right, everyone, it is a pleasure to welcome this dream polling team, this dream conversation team we're having from KFF. We are thrilled to welcome Liz Hamill, the Senior Vice President and Director of Public Opinion and Survey Research, Ashley Kurzinger, the Director of Survey Methodology and Associate Director for Public Opinion and Survey Research. And from Navigator Research, we are super happy to welcome their Managing Director, Melissa Tufanian. Hello to all of you.
Hi, thank you so much for having us.
And joining this party is Aaron Everett. Aaron is our good friend of the pod. He is a Substacker for Besides the Revolution, which is his Substack, and a writer for prominent MAHA influencer Jessica Reed Krause's newsletter House in Habit. Aaron is a MAHA supporter and a former Kennedy campaign volunteer. How's it going, Aaron?
Good. Nice to see everybody.
Nice to see you, and welcome to all of you. So, okay, we've got a bunch of pollsters here. We've got Aaron here. And we're going to walk through the numbers that are jumping out at us. And what we really want to focus on is the mind of the American public. Americans have a lot going on right now. So how much is health and healthcare a top issue for them in their lives? Where does it rank compared to things like, say, immigration, war, the price of gas? Is MAHA still resonating with voters? So we're going to get into all of that. So Melissa, I'm going to start with you from Navigator. In recent times, the issues that most drive people have always been the so-called meat and potatoes issues. Things like how much money is in their wallet, how much they have to pay for gas, how much they have to pay for food, and whether they feel safe in their communities. How salient is health and healthcare really? What are you seeing? And at this point, don't talk numbers. Just kind of tell me the bigger picture here of what you're seeing.
No, I think it's incredibly salient. And I think both in our quantitative data, so in our polling, and we also do monthly focus groups, which are qualitative data, where we get to have conversations with Americans from across the country. Healthcare is top of mind for nearly everyone that we talk to. And I would say it comes out in a few different ways, in that people are really worried about rising healthcare costs. They're really worried about the different sources and information that they're getting on healthcare. I think people's views on healthcare are really diverging, and they're hearing different information and having different perspectives and different inputs out there. So I think on costs, on information, and just on worries. I mean, everyone's word of the day is affordability. And so I think healthcare fits into that, and it fits into both immediate and longer term economic concerns. And I think the last point I'd make is there's also a lot of concerns just about our healthcare system in America. People feel like our healthcare system isn't working, that there are myriad issues that we've heard in our focus groups on what people are concerned about. It's a topic we're going to actually explore next month with our focus group, particularly focus on healthcare and people who have lost healthcare coverage. So I think it's top of mind across different partisan ideologies, across the political spectrum for Americans.
Ashley Kurzinger from KFF, over the years, healthcare affordability has popped up as a salient issue. Are you seeing any differences this time around? I'm definitely noticing that it's not just healthcare, but health itself is popping up as an issue. What are you seeing as some just general themes?
Well, I think we need to take a step back and think about how the way polls have typically asked voters about the issues that they are weighing when they're going to vote. So typically in exit polls or in pre-election polls, voters are given a list of issues and said, okay, which one is the most important to your vote? And over the past several decades, the economy has always been the top issue for voters. In fact, healthcare was only the top issue one time, and that was following the failed repeal of the ACA during those 2018 midterm elections. That's the only time that healthcare ranked to the top issue, and it was largely driven because among Democrats, healthcare policy was driving them out to vote because they didn't want to see the ACA repealed during those repeal efforts in 2018. And so it's always been the economy. What we are seeing now is that more and more healthcare affordability and the cost of the healthcare is becoming a bigger and bigger economic issue. So healthcare has always been a part of that, but when voters are asked about the economy versus healthcare, they don't know really where healthcare costs weigh in that. Is it a healthcare issue? Is it an economic issue? And so now what we're seeing is that at the beginning of 2026, we found that when we ask voters and ask the public what is their top economic worry, healthcare costs are their top economic worry. It rises higher than the cost of food and groceries, utilities, housing costs, and the cost of gas. Now, granted, this was a snapshot of time. Pollsters will always tell you that a poll is one snapshot of time, and this was prior to the recent conflicts in Iran or Venezuela, and back when gas prices were still below $4 a gallon. But what we did see there, and that was something new that we had seen, was that healthcare costs were ranking at the top of people's economic worries.
Liz, I want to just bring you in on that as we start to dig now into these numbers. And, as we've laid out, this is sort of shaping up to be the affordability election. That's the prime driving thing that I guess pollsters everywhere are sort of picking up on. And in that sort of setup, we've got these healthcare costs, the amount of money my family has to spend to afford healthcare month to month to month. That has risen up. And it's, as you guys are tracking, it's a bigger worry than how much I spend on food. It's a bigger worry on me paying off my student loans. It's a bigger worry than I spend on transportation and housing. Just talk a little bit about that phenomena of healthcare costs sort of sliding right to the top. And that's also something that we're picking up across all parties, right? I mean, this is MAGA Republicans. This is Democrats. So Liz, just talk to a little bit more about what you're seeing in the numbers there with that.
Yeah, I think there's a few things behind that, right? I mean, we have seen that even for people with health insurance, over time, we've seen those costs continue to rise. We've seen the squeeze on employers as, most people get their health insurance through an employer, but over time, that insurance has become costlier and costlier. Employers are paying less of the premium. They're switching to higher deductible plans. And so people are either paying more out of pocket every month for their insurance, or they're having to pay more before their insurance will start covering things. So that's a trend we've seen over many decades. So really, a lot of what is behind this are people are actually experiencing more and more of those healthcare costs. Another thing that happened, at the end of last year, the enhanced premium tax credits for people who get their health insurance through the ACA marketplaces expired. Now, that sounds like a very technical thing, but it meant that for a small portion of the population, they saw enormous increases in what they were paying for health insurance. On average, their premiums were going to double, but for some people, their premiums were increasing by 400%. And so, again, that was a small part of the population that was affected, but it did get a lot of news coverage, and a lot of people saw that, or they had friends and family who were experiencing that. And, they just have seen this small group that experienced this sort of outrageous increase in costs. And so that's a big part, I think, of why we're seeing healthcare worries, the worries about the healthcare costs really popping at this moment in time.
Erin, let me ask you, I just looked at your face and you were kind of in disbelief at some of these
I saw you
numbers.
nodding at times.
I know. You were like, oh,
Frowning.
man. What's going through your mind when you hear some of this stuff?
Oh, I just think it's a total tragedy for the American public. It's like the most disheartening thing that you could experience. And so much of this, I keep thinking about the rhetoric about when the ACA was passed and all the all the stuff about, hey, this is going to kind of liberate people and have the opportunity to go out and start a small business because now they won't be afraid of doing, healthcare costs. And it's actually turned out to be the exact opposite of that, which is, from my perspective, is always what happens when things get involved. When somebody says we can target this solution with government, sometimes it's what happens. The unintended consequences of this stuff is pretty significant. And it's hard to watch it all happen. I know particularly, like, we had to make a different decision as a family in 2010 or 2011 because we couldn't even afford what we were doing. I'm a small business person, so like trying to find solutions. We've lived on a health share co-op for the last, whatever this is, 17 years now, since that started. And it's been great for us. And even in that system, we pay cash at the doctor. We're kind of in a position where we could do that, and we could pay we pay our share, I guess, to somebody else that goes out each month. And that share, when we first started for a family of 6, was about $400. It's gone up to about $700, which is still incredibly cheap in the landscape of healthcare. And I think about just people who are in the world that are like, well, how would I even do this? And now it sort of forces them to be in an employment situation so they're any entrepreneurial dreams, any sort of things that they're hoping for are just kind of killed and squashed before it ever starts. And we just kind of go back to the same thing. And it always comes back to the fact that the money doesn't buy as much as it should. And the healthcare stuff is very frustrating because here's this giant portion of my check that has to go into something else. And all out of this fear that somewhere out in the world is this thing that's going to kill me or hurt me or whatever. And it's a real fear because the costs are they're just too much.
Yeah. Melissa, you guys at Navigator did an interesting poll. You took a look at 62 battleground House districts. So we're talking midterms here, and 7 Senate battleground states. And you asked likely voters, what is the highest priority for Congress? Like, we're going to give you a list of things that they could do, a to-do list. What's the highest? And my understanding is you guys found lowering health care costs was the number one rated thing when it comes to this is an extremely high priority for Congress. Just talk a little bit about sort of how that landed with some other things you asked about and how that was a singular to-do list item for Americans in these battleground districts.
Yeah, absolutely. And so I think I would start by just saying what Aaron just shared on his own personal experience with the healthcare system is something that we hear consistently from Americans. And so what we set out to do with this battleground poll was to better understand what are kind of the food and health related issues that are most salient, most important, that they want Congress to focus on for Americans in these battleground districts. So that was the goal. And so what we did with setting up kind of the research question that you referred to is trying to measure some of these food safety, some of these food related issues against like almost taking a yardstick measurement against how do people feel about them when we measure them against lowering the cost of healthcare or other issues that we consistently hear are issues of top concern like border security or immigration, and just tried to get a sense, how does this stack up for these food safety issues? But really what it showed for us is that for battleground Americans, it was 68% who think that lowering the cost of healthcare is the most important thing, the exact wording, extreme high priority for Congress to focus on. And then after that was making sure that our food is safe. But this was our most recent battleground poll. We did another battleground poll with the same sort of sample size, the same population that we looked at back in early February. 80% of respondents in that poll said that they think that their healthcare costs have gone up. Obviously, if your costs are going up, it's a point of concern.
Right.
That's when we look at the different partisan makeup of that group of 80%, 2/3 of Republicans, 77% of independents. So this is an issue that I know we talked about earlier about that people are it's really salient, that people are really they're feeling these costs. They're frustrated. They don't understand why they're going up, right? Our healthcare system is really complicated. The lack of transparency is something that we hear about a lot. And so when we tried to assess, what are the most important things for Congress to focus on, it really underscored for us that lowering the cost of healthcare is a top concern.
So it's like the American public is like screaming out.
Exactly.
Out. This is the number one thing we want you in Congress to do. Both parties is lower my healthcare costs. Tops.
Yeah.
That's fascinating. Talk just also about food safety. So I think food safety that's like listeria and salmonella, but I think you're bundling it in is there chemicals in the food? Is there pesticides in the food? Like, just explain that. And I think that's interesting too, because there's lower my costs for healthcare, keep my food safe is right like second, right?
Wait, like more than Iran and
Well,
crime and stuff?
It's a good question because for this one in particular, we didn't, with this kind of call it battery, like with this list of issues that we asked people about, we didn't include Iran or crime, right? But we didn't include the border security. Border security was like roughly 48%. So like roughly half of people think that that's an extremely high priority.
and 67% for lower my healthcare costs, right?
61% for food.
Right.
It's just
So
how
much
they're
higher.
stacking up, right?
Yeah.
And so I for food safety, what we didn't define it specifically with this question. I think throughout the survey, though, in the different questions, the information that respondents were given, we talked a lot about chemicals in foods. And so I think people are really worried. They're hearing about cuts at the FDA, cuts to food safety inspectors. They're worried about the food that they're feeding their families, whether it's because of these cuts that perhaps the food inspections aren't happening. They're worried about pesticides or other chemicals that can be in foods. I think people are also hearing about other chemicals and other food inputs that are banned in other countries. One particular example that we looked at in the survey is a chemical called paraquat that I actually learned through the course of doing this research. It's a chemical that is primarily produced in the United Kingdom and China, but it is banned from being used in those countries. It's not yet banned in the United States.
Right.
So I think
and it's linked. It's like there's research to suggest it's linked to Parkinson's.
Exactly. And so one example of a harmful chemical that has not yet been banned and is not being regulated in the United States that I think people are hearing about from all these different inputs of information that they're getting on healthcare, and they're questioning, like, is the food that they're putting on the table to feed their family safe? And so what we saw here is that that's a top priority. They want lower costs for healthcare. They want to be sure that the food that they're giving their kids, that they're feeding their families is safe. And then I think the third that we haven't explored yet that I'm sure we'll get to is just the affordability of it all. Just being able to afford food in general as we see these grocery prices increase for various different reasons, but wanting to also try and make sure that that the food that's affordable is healthy and good for their kids and their families.
Ashley, it's always interesting looking at polls that are issue driven versus behavior driven, right? And I think we all chatted about this at some point, which is like, sometimes if somebody asks me a question in a particular moment, my answer can be complicated and my thought process can be complicated. And I don't know if that complexity is often reflected in a poll number. But one number really blew my mind from your guys' poll. Over 1/3 of adults, this is from KFF, over 1/3 of adults are skipping or delaying healthcare, which means they're not going to the doctor due to cost. Ashley, tell us about that.
Well, I think what is really striking about that is that it's not just impacting a certain group of individuals. So it's not just older people. It's not just uninsured. It's not just people with lower incomes. It really is impacting a wide kind of diaspora of Americans in this country. And so what happens when people skip or delay care? They get sicker. And so and then they eventually have to get some sort of care and having to pay more, may have to go see a specialist. A chronic disease may no longer be in maintenance phase, and they may having to go and get additional care for that chronic disease. So it's not just the one action of skipping or delaying care that is the number that I actually think is really important. It's what happens to people after skipping or delaying care, right? That they are going to get sicker. And so that is and then that puts an even greater burden on our country's healthcare system and our country's providers and hospitals and our physicians. And so we know that we want people to get routine care. That's kind of what helps keep people healthy and safe. And so when people are delaying that because of cost, and knowing that that is impacting not just our sickest populations, not just our poorest populations, but just kind of a large share of us across income, across education, across partisans, that is what's really striking about that number to me.
Yeah, Liz, tell me a little bit more about that, because there's several people I know who have sent me that statistic. What did you derive from that?
Yeah, I mean, I think, one of the reasons we see people skipping and delaying healthcare, it's all related to these trade-offs that people are making. And it reflects what I said earlier about the increases in deductibles and cost sharing that people are experiencing with their health insurance plans. So even people who have good insurance or what they maybe think is good insurance, they may have a $2,000 deductible. That means, well, do I really need to get this thing checked out, or am I going to put food on the table this month, right? Like we see this time and again in our polling about the trade-offs that people are making. So for example, when we did a survey of people in the ACA marketplaces who, despite those premium increases that we talked about earlier, people who stuck with their ACA plans, but they are telling us that they are having to make trade-offs to keep those plans. The health insurance is so important to them, especially if they have chronic conditions that need to be treated. They really value having that health insurance, but they may be holding on to that insurance for emergencies and not using it for routine care, and deciding to do things like, use an over-the-counter method rather than checking something with a doctor, or relying on other treatments, home remedies and things like that.
Yeah, we talked a lot about the the ACA subsidies running out and being allowed to lapse. So that's the Republican-controlled Congress did not act to extend those subsidies, which help lower income Americans afford healthcare coverage on the open market. Democrats, when they control the Congress, they didn't act on this either. We are where we are. I have a question actually to Aaron about that. KFF, our friends here, polled on this, and they're finding that 67% of Americans say Congress did the wrong thing by not extending those credits. That includes 72% of independents. We do have some Republicans and MAGA supporters at like 64% saying that was the right call. But overall, Americans in general, 67% said Congress did the wrong thing by not extending those credits. How much do you think that is going to factor in? I mean, this feels like a very real thing that happened. It's a smaller percentage of Americans who buy their care through the marketplace, but it's really being felt by those people. And I think everyone's sort of seeing that or hearing about that. I'm just curious what you think that's going to do sort of on the ground in the communities that you move through. Like, what is that? How does that play out as we move towards the midterms, do you think?
Well, I don't think there's a person alive that thinks the Republicans are going to do much in the midterms. I think if you translate it, they're going to get fairly shellacked, maybe even more so than even any other time, in the past. I mean, it may be even a bigger swing than the 2010 ones in terms of how it was responded to. That was a fairly transformative election in midterm terms, I suppose. I think.
Why do you think that, Aaron? Why do I think that? Yeah, like that it's going to be such a big shellacking.
Oh, I just think this coalition of people that was kind of cobbled together in the end of 24 was a very tenuous coalition. I mean, you had people that were kind of very reluctant about the whole situation, and they had their items and their hot buttons that were sort of significant to them. One of them, of course, being war. One of them, of course, being kind of this health conversation, and to the point of like, is my food safe? The one guy who's fought for like the last however many years talking about pesticides and everything else has to go out and make a tweet that's 4 pages long about why we are okay with glyphosate or however you say it, so that we can continue our industrialized farming. I mean, it's like
you're talking about when Kennedy had to come out to support Trump's executive order on producing glyphosate.
Yeah, I mean, I think most people are disillusioned and disappointed. They think, okay, well, here's this system that we're supposedly in charge of as the people, and no matter who we send up there, the machine marches on. And I think that's a real thing. And so I think that's actually what you're going to. I mean, this is like prognostication or predictions for the future, but I think you're going to see this at every election now. The swings will be bigger and wider because people are just frustrated. Like, these poll numbers are real things that people are going like, hey, this is a real issue in our world. I mean, and you're not listening. Like, and it goes back to trust. Like, okay, so people aren't going to the doctor. Is that because they can't afford it? Probably, but it's also probably because they have some skepticism and some reluctance about it because of everything we've gone through. So there's just this, like, no one in Washington is listening to the people that are actually asking the questions to say, we need these things or we want these things. We hope that you can do something about them. or tell us the truth that you can't because the machine is so big and we'll have to go invent our new system because this isn't working. And I think that's just, I don't know. I just think that's where we're at. And I think it's very, very complicated to think that we're going to just go through politics as normal.
Yeah.
From here on out, I just don't think it's going to happen. I think people are disillusioned with it. And the point that these folks are finding, where you're talking about stuff that are real things, about like I'm making trade-offs between whether or not I can go to health, I can afford healthcare, or what food I'm going to put on my table, and if that food is on my table is edible. I mean, those are all just like, how in the world? I mean, on one hand, I'm really grateful that we're having those conversations because they're very, very necessary conversations in America, but only the people are having those conversations. Politicians are just marching forward, doing what they're doing, and people are getting more and more exasperated by it. So I think these midterms, and I don't think it's just because it's Republicans. I think it's, to your point, Tom, like no one's done anything about this. Democrats had the chance to do it. They didn't. Republicans have had the chance to do it. They didn't. And it's just this kind of the money that gets into Washington to move the needle, it doesn't move the hearts of Americans.
Our Zoom is lit up. Melissa, you had some thoughts, and then we'll get to you, Liz.
No, I think what Aaron hit the nail on the head in a lot of ways. And I think if you look back in the last year and we see Republican control of the House, the Senate, and the White House, but what have Americans gotten? We've gotten the lack of extension of the ACA tax credits that were mentioned earlier, right? So there's an increase in your healthcare costs. We've gotten the gutting of Medicaid. There's another increase in healthcare costs and a lack of access. Then we got a massive cut to SNAP, which food assistance, making it harder for seniors and kids to get food. While at the same time, I feel like Tom was laying out that part of the story. And then the second part is, well, okay, so what did happen? We got tax breaks for billionaires. So it's like it's a priorities issue. We also do research at Navigator that I think is really relevant, where we call it our gap in focus, but we ask people, what do you think are the most important issues for Congress to focus on, for the president and Congress to focus on? And then what do you think they're actually focused on? And the gap here that we've been seeing over the last year is, honestly, I think it's so important for every elected official to see, because what people say are their top priorities are inflation, lowering inflation, the cost of living, jobs in the economy, and then healthcare, which we're talking about today. What do people think that the president and Congress are focused on? Immigration and foreign affairs, foreign wars. So just understanding that the top three and their top three don't even line up. Like, they are focused on the wrong issues. They're moving people backward. They're making their life harder and more expensive at a time when we go back to the beginning of the conversation saying that people are screaming. We see it in our data. We hear it in our focus groups. People are screaming for help, and they're just not, it's not being delivered to them. And then I think Aaron touched on this too. It's that people are then feeling frustrated and disaffected. And it really doesn't matter if Democrats are in charge or if Republicans are in charge. Like, my prices aren't going down and my life's not getting better. And so then I think they're sitting out and they're feeling frustrated and feeling like no one's going to bring about change.
Don't forget, we got $39 trillion in debt too. So we got a lot for all that money, right? I mean, that's the other piece that just is maddening. You're like, what have we spent all this money on? My kid is 18 years old. When Obama took office, the debt was 10 trillion. We're at 39 trillion in 18 years. That's like, no wonder people are going, what do we have to show for this? This is zero, and that's the exasperation that I think is in everybody's mind.
Liz Hamill, you had a thought from KFF.
Yeah, one thing I just want to add as somebody who has been doing polling on healthcare issues for a really long time is it is really easy to find agreement among Americans on what the problem is. It is way harder to find agreement on what the solutions are. So yes, we may see huge shares across partisan lines saying, I think healthcare costs are a huge problem. I think food safety is a huge problem. But when you start asking about the potential solutions to those, should we be having more government price controls, or should we be having more free market solutions? That's where you start to find more divisions among the public. And I think it's one of the reasons that, despite agreement on what the problems are, we often don't see as much progress as voters would like to see on the solutions.
Yeah, for sure. It seems also like, just kind of listening to what Aaron was saying, it's like this thing has become really potent now, where you've got affordability worries merging with affording care, healthcare, access to a doctor, merging with I'm worried about what's in my food. It's like the affordability is getting turbocharged now by it's getting really life and death for me, whether I can go to the doctor or not. And I just feel like that's sort of bring us out of this, am I for Obamacare or against it fight, which has dominated politics for many years. I mean, Ashley, do you want to just talk about that, the change we're seeing right now?
Well, I think the debate around the enhanced premium tax credits for those ACA enrollees is a perfect example of this. At the beginning of the debate, when we were talking to Republicans, to Democrats, to independents, a majority across all three said that they thought Congress should extend these tax credits. They saw this as a tangible way for Congress to help people that are buying their own health coverage and really struggling with a huge increase in costs. And as the debate went into Congress, then the party lines start getting drawn, and people saw it as a pro-ACA or an anti-ACA vote. And so that is then where we saw Republicans saying, okay, never mind, I'm not in favor of this because I see it as an extension of the ACA, which I have a negative opinion about. And so, it's this idea that we want to see Congress do things to help people, to help bring down healthcare costs, but there is always a line in the sand around this, the ACA. The ACA is still incredibly partisan. And so anytime it's framed around Obamacare or the ACA, then we see the party lines really divide in what they want to see Congress to do. So speaking to Liz's point, yes, everyone wanted to see Congress do something to help these people. But then when it was framed around the ACA, then Democrats were in favor of it and Republicans were against it. And then there was no appetite in Congress to do anything for it.
Yeah. The other thing Aaron said, which is just so true, is that, stepping back, it looks as if the advantages are all shifting towards the Democrats, which is not uncommon for, the out of power party. In these midterms, they make advances. The party that has the power gets, takes huge hits. It's sort of the seesaw of our politics. But just sticking with you, Ashley, for a moment, just talk through what KFF is finding about the Democrats' advantages at this point. When we're talking about things like determining the future of Medicaid or the future of the ACA or Medicare, like just walk us through sort of some of the basics of where the public is in terms of who they're supporting on some of these health-related issues.
Absolutely. And, Aaron is right that, we are seeing definitely an enthusiasm advantage for Democrats, but our elections are kind of set up in a way that there aren't that many competitive states or competitive districts anymore. And so while there may be kind of an advantage for Democrats right now in terms of enthusiasm, that doesn't mean that we're going to see huge swings. So, I'm still a little, cautious about like what we are expecting for the 2026 midterm elections and whether I imagine that we will see, maybe not the huge swing that Aaron is talking about because of the way that our system is set up. But when we look at healthcare issues, that's another way that I'm also a little, the data isn't actually that clear. Yes, Democrats have an advantage on healthcare issues. They have an advantage on which party the public trusts to handle Medicare, Medicaid, now healthcare costs. But the voters that are really swinging elections, those independent voters, a large share of them, more than a quarter, say that they don't trust either party on these issues. So, in states where we might want to be seeing, increased enthusiasm, there may be a large share of voters that may be staying home because they aren't motivated by either party. They're disenfranchised by both parties on these issues. And so they may not be showing up for Republicans and they may not be showing up for Democrats.
Yeah, we'll have a depressing end to this conversation all about the collapse in trust on all sides. But Liz, I want to just ask about one thing where President Trump has really put a stake down and tried to make strides, and that has to do with the cost of prescription drugs. And that seems to be a place where the Republicans are sort of evening the field here when it comes to where the public is in terms of who's best able to handle the rising cost of prescription drugs. Can you just talk about that?
Yeah, definitely prescription drug costs is something that President Trump has tried to make a signature issue, both in his first term and now in his second term. And we have found that the trust gap for Democrats over Republicans on drug costs particularly has narrowed. But actually, in our latest poll, we do still see a clear majority, not majority, but a clear preference among the public for Democrats over Republicans, even on prescription drug costs. We saw President Trump launch Trump RX, and he's talked a lot about the deals that he's made with individual pharmaceutical companies. In our polling so far, there's not a huge public awareness of those, but some of them are pretty new. One group that we saw that was more interested and more likely to go look at whether Trump RX could save them money is people who are using GLP-1 drugs, which is a growing share of the public. And so I think there's still potential for those ideas to take hold and become more popular. But at this point, most of the public is telling us that they don't think that that the Trump administration's policies are going to bring down the cost of prescription drugs for them and their families.
Melissa, you at Navigator looked at kind of the issue of trust largely, like more generally. What did you find?
Sure. So we constantly try to track different issues. Which party do you trust more? And so on healthcare, we found when we asked you, do you trust Democrats more? Do you trust Republicans more? About 44% said they trust Democrats more. But what I think is actually really interesting is that 19% of people said they don't trust either party. They don't trust Democratic Party. They don't trust the Republican Party. So I think our conversation has been a little pressing on what could come next and what are the actual tangible policy outcomes to make people's lives a little better, which I think you can look at that number and be a little depressed about. But I think it's also an opportunity. Like we talked about, Democrats do have the advantage on this. If you are a Democrat, or working for a Democrat and think about you already have the party trust advantage on healthcare, you should lean right into that. And that you have this 19% who might be disaffected and not trust either party right now. But I think Democrats, with the fight over extending the ACA tax credits, people heard and saw consistently that Democrats were the party fighting to lower their healthcare costs or fighting to prevent their healthcare costs from going up. So I think that for Democrats, they should lean right in on healthcare issues and be the party that's fighting for those lower costs. And that I hope that Republicans see that this is what the American public want and can find ways that we can work together and try and turn down the temperature, as hard as it might be. I know Ashley and Liz made some really good points on just the partisan split over Obamacare and people running to their own camps when they hear that. But I think that there are still opportunities to try to lower people's costs, and maybe even on increasing transparency in healthcare costs could be a way that you could bring people together, and so that people can just better understand when you get a hospital bill that's maybe tens of thousands of dollars, why is it like that? And then hopefully through having transparency measures implemented, that then there's an inability then to price gouge people on it. So I think we just have to think creatively to try and lower people's healthcare costs in ways that we could get bipartisan support around it. Maybe that's wishful thinking, maybe too optimistic, but I do still think that there's an opportunity.
Yeah, there's a number in this Navigator Battleground poll. So, and Melissa, tell me if I get this wrong, but you gave a list to voters, likely voters, things that this Republican Congress or this Republican administration have done that relate to the broad subject of health. And I found this one really interesting. This administration, this Congress, not banning certain quote unquote dangerous pesticides was a top 3 concern for 45% of the voters in House battlegrounds and 47% of the voters in Senate battlegrounds. I just have to feel like MAHA has elevated this issue and kind of opened people's eyes to this issue. I mean, just what's your reaction to that? That nearly half of people in these battlegrounds are saying that is a top 3 thing that I'm upset that we didn't do right now with the power dynamic that we have.
Meaning like regulate these pesticides.
Regulate these pesticides.
Yeah. No, I think it was really interesting to see what kind of the top three issues that were kind of the themes that we found throughout this survey that people want action on and that they're really concerned about is the food safety piece, the SNAP cuts, and then I think relating to food safety is almost calling it like a corruption bucket. People that are worried about having these lobbyists from big food and ag who are now overseeing our food policy. And I think that feeds into the food safety piece because as you're hearing about food safety inspections being cut, budget for FDA for food safety being cut, you're also seeing people who have ties to big food and big ag in these positions where they are overseeing our food policy and people being worried about their own motivation. Are they motivated by keeping the American public safe and keeping these chemicals out of our foods, or are they motivated by raising profits for these big corporations? So those were kind of the three different, the SNAP cuts, the food safety, and the corruption piece. But I kind of think they're all connected, to be honest, and that there's a story to be told there that when you have these cuts to FDA, when you have these massive, these research cuts, funding cuts, SNAP cuts, and that you allow this potential corruption, and people that may not be putting the American people's interests first, that's hurting our food safety and making us less safe. And I think, going back to your question on MAHA, I think that they've elevated those concerns so that when you have these various pieces, people have heard about MAHA concerns, have heard about a lot of these issues, that they're primed to almost connect the dots, is what I would hope, and to understand that all of these issues coming together are not actually making us healthier, that they're actually making our food less safe and making Americans less healthy.
Aaron, what goes through your mind with this list of stuff?
No, it's totally right. I mean, I think that's really what the heart of what actually compelled me to even be involved in the Kennedy campaign at the beginning was that root cause. And it's not just in food, but it's in almost every form of government, whether it's military or, finance or whatever. You have this sense that the government, which is instituted amongst men to secure their liberties so that they can, go out and live free lives. Now you don't have the watchdog that's supposed to be doing the thing that prevents mercantilism, which is really what the whole founding of the country was about. It was an intention to say, like, we don't actually want this mercantile system in which the crown's buddies get their favoritism. We want to go away from that. We want to live a different life. And so we institute a whole new system, do a whole new deal. And now we're like on 250 years later, and we're right back to where we started in this, which is that there's a mercantilist system that functions in Washington. And that's it. And that's the major concern here, I think, for most people is that, look, and I'm fascinated by your 19% number because that's probably where the Kennedy world sort of sat, this independent group of people that sort of said from a national polling perspective, like, I don't trust either of these people. I don't trust either of these parties. And actually, the real issue inside of Washington is exactly what you're saying, that there's corruption and that there's this sort of graftish system in which you pay to play, and the people that are, harming us and talking about what's on our food and all of the different things. Those, I think, were why Kennedy and Trump actually, it's a huge portion of why they won. And it was because there was this sense like, okay, here's a guy that's actually fought for all these years and doing all of these things that are, truly actually advocating for the dismantling of this mercantilist system. He's joining up. And you heard people at the end of the campaign in 24 going like, when was the last time you heard Republicans talking about food safety? When was the last time you talked about anti-war? When was the last time you heard Republicans talking about all of this litany of issues that are actually the heart of American people? And I think the MAHA stuff was actually all a part of that. It wasn't just, the MAHA thing gets me a little crazy because it was a joke. It was a hat. It was like a joke in the middle of the campaign to poke at Trump when we were doing stuff. And this has now become this sort of activist movement, and it's been relegated to this like, well, all we can talk about is health. But the truth of it is that Washington, the issues that motivated MAHA are the same things that actually motivated, like, we want to dismantle what is happening within Washington in all the spectrum of what's happening in terms of politics. We're not interested in a mercantilist system. We're not interested in your buddy gets to get to the table because he's got more money than I do as a citizen. That was what we wanted to dismantle. And so we made a trade, and a bunch of us voted for this, what we've got. But it was because we thought that perhaps that these would be the things that would come up, and we would have more of these conversations, not less.
Aaron, there was this, you wrote this essay, and we're going to put this essay in the chat. I really would urge everyone to read this essay because Aaron, we invited him to attend this public health conference. And already just that phrase, we invited Aaron Everett, a MAHA supporter, to attend a public health conference. And he wrote his thoughts. And one of the things he wrote was, quote, "I'd be lying if I said that my heart hasn't been bent towards repentance for my part in the whole thing. I helped champion Bobby Kennedy as a campaign volunteer, and when he joined up with Trump, I reluctantly, yet calculatingly, decided that the trade-offs were worth what I believed Mr. Kennedy could advocate for within the walls of a Trump White House." What are you thinking today?
Yeah, I mean, I still adore RFK. I mean, I still think he's like, if I had a chance to say, hey, this would be the guy that I think could fix the country, I still think that. I mean, maybe I'm limited in my supporters that would still come along with me. But I feel like what he was saying during the campaign, I got involved in his campaign because of so many other things. I mean, the health thing was just a piece of it, and I agreed with it, and I thought it was true. But there were so many things in his campaign when he was running as a Democrat and then as an independent that I resonated with, and I thought they were really, really the best way for us to fix the country. My disillusionment with it is that at the moment, at least, or my sense of repentance with it is like, gosh, all the things we talked about, not going to war and being able to fix some of these things within the FDA, being able to fix some of these things within the EPA, being able to sort of, and that was what the idea of being over the head of HHS was supposed to be, or overseeing all these departments that we thought, gosh, this is like, man, and there was no quid pro quo. No one said that he was going to be the Health and Human Services Secretary, but we all kind of gathered that it would be somewhere in that world that he would be operating. And so we made this trade. And I don't know. I still find myself, I was a reluctant, I'm not a Trump person. I haven't been the whole time. I find him too much. And I find that the influences that influence him in terms of people that come in the room and sort of have the ability to say the things that they want, that he likes to hear, always win the day. And so, I had hoped for this kind of robust debate between those two men, and then they had a chance to say, like, look, we're doing this the wrong way. And at the end of the day, Kennedy works for Trump. And so he's got to go out and put a 4-page tweet together about why it's okay to have industrialized agriculture when all of us are like, well, that's what I thought we were trying to unwind. So, this is off topic from the polling, but I think it's at least parenthetical to the thought that, look, so many of us are sitting in this system and going, look, you guys, the system is the problem. That's what we're sending you there to fix, and you're not doing it, and you just can't participate. And that's maddening to so many people.
Well, I think another data point you're revealing is that this group of people didn't see something in the Democratic Party that they found could support them, right? Which is why they reluctantly went into this alliance.
Absolutely.
Liz Hamill from KFF, you had a thought.
Yeah, I just, when Aaron said that, MAHA was a hat, it was a joke. And now we see, when we ask people, do you support the MAHA movement? We have 4 in 10 people saying that they consider themselves supporters of the movement. So there is a large share of people that say that resonates with them. But we see it is almost complete overlap with people who say they support the Make America Great Again movement, and that MAGA MAHA overlap where it may be people like Aaron who were on board with these ideas way before it was called MAHA may not identify with Trump and the MAGA movement, but in the public at large, those two things are really, pretty synonymous in terms of who identifies with them. The other thing I would say, the sentiments that Aaron was expressing in terms of frustration with the way that government works and the way special interests play a role in that is something that we see reflected in our data. When we ask people how much confidence they have in federal health agencies to act independently without interference from outside interest, or how much they trust these agencies to make decisions based on science rather than the personal views of the people in charge, people across parties express low levels of confidence on these things. And so I think a lot of those frustrations, that Aaron shared are really shared broadly among the public.
Well, so let's move to talking about MAHA, Kennedy, kind of what the country feels about all of this. So I think an interesting calculation is being made right now, at least we assume it is being made, that, if you pivot HHS away from Kennedy's vaccine work and you pivot more towards food, nutrition, and healthy eating, that's more winning. And you've been seeing things like, changing of the staff at the CDC. You're sort of taking away people who've been associated more with more vaccine skeptical views. You have this judge that just ruled that effectively has stopped any of the changes that Kennedy has made to the vaccine schedule. And I wanted to start first with Navigator. We'll start with you, Melissa. Talk a little bit about what you're finding about views on Kennedy in these battleground House districts. And also, I wonder I think it's really interesting when you take people's views on what they view as Kennedy as part of an administration, as like part of the Trump administration, versus Kennedy on his own, which I know is like kind of hard to gauge because he is part of an administration. So I wonder if you might kind of tackle all of that, Melissa.
I'll do my best, but I think for us in the battleground poll that you referred to, just to share some of our numbers, and I think it's really interesting, and be really interesting to hear from KFF if they've had similar results. But we asked people about for RFK on popularity and job rating, and so we find overall that he's about 7 points underwater on popularity. So about 45% have a favorable view, 52% have an unfavorable view, and then on his job rating, he's underwater by 12 points. So we have about 42% who think he's doing a good job, about 54% who think they have a negative view. They don't think he's doing a good job. And just to put that in perspective for Trump on popularity, on favorable versus unfavorable, he's underwater by about 6 points. And on job rating, he's underwater by about 8 points. So I think it's interesting that for popularity and for job rating, that actually RFK is more underwater than Trump. And so we just asked those questions. I think there's a lot more research to be done, so KFF might have more on that.
Let's ask the KFF folks.
Yeah.
I mean, Ashley, you guys have a sense of, are Americans approving of the job Kennedy's doing at HHS?
Yeah, so interestingly, when I was listening to Melissa's numbers, I think our numbers are pretty similar. So it's a little less than half. So about 45% of the public overall approve of the job that Kennedy is doing at HHS. Interesting, and it kind of like brought about what Aaron was talking. He actually doesn't get that high of approval among MAHA supporters. So while a majority of MAHA supporters do approve of the job he's doing, only a quarter of them say that they strongly approve. So even among kind of his core group, his strongest supporters, he's not getting a huge number of people that are saying that they are strongly approving of the job he is doing. And we ask about it in terms of his job at HHS and his job on a vaccine policy. And those numbers are pretty similar. So the public isn't able to separate his work and his changes that he's making to vaccine policy to his job overall at HHS.
Yeah, I saw one number that you guys did right after the big January changes to the vaccine schedule of changing the number of vaccines that are universally recommended. Something like 72% of Republicans and 69% of MAHA supporters approved of Kennedy's changes and approaches to vaccines as the head of HHS, which you would think that's higher. I know there's, once you delve into MAHA, it's a complicated a crew that have sometimes competing interests. Some people think he didn't go far enough. Some people think he's gone too far. Aaron, what do you make of that? The kind of softness of support, even among MAHA, for Kennedy on vaccines or in general in this job that he's having to do?
Yeah, and I kind of want to go back to the end of the election because I think it's really important to kind of contextualize this. I would not have made a different choice. Like, I made the choice I made, and with the information I had, I mean, if I had it even today, I still wouldn't make the other choice. Like, there wasn't a better option, frankly. So this was the option that was on the table. This is the dumbness of American politics, that you get to pick the lesser of two evils at all times, and it's still evil and all of that kind of stuff. So I contextualize that when I say this. And I still think if Kennedy had been had more traction and had a little more opportunity to speak to things, his message would have resonated much further, but he was just blocked out of everything as a volunteer in the campaign. I mean, we just were blocked out of everything. Debates, we were blocked out of everything. Anytime we kind of got to the threshold we were supposed to, and we met that threshold, we were stopped. So I think there was intentionality in that. There was some purpose behind that, good cop, bad cop stuff that was playing in both sides of Republicans and Democrats. And I think this was the chance that Trump took to say, well, I can win the election by getting a hold of these people. We'll make some promises. We'll let him go. And he said it. I mean, you just have to listen to Trump because he's very clear. We'll let him go crazy for a little bit. And then that was kind of his joke. But it was like, that's kind of it. He got to go crazy for a little bit. And now he's in the corner playing with his food dyes. And that's the disillusionment that I think most Kennedy supporters are like frustrated by, which is that it's like, really, this is what we get to talk about is food dyes? Like, cool. I'm glad they're going away, but that's not what we were after. That's not what we were wanting. And if I had him in a room by myself, I bet he would say this is not what he's after either. I think he wanted much more aggression, much more opportunity to have these discussions in the open about the mercantilist system, about sort of collusion. Look, most MAHA people are not anti-vaccine. They're anti-corporate influence on medicine. That's what they're frustrated by. They are not anti-vaccine. They are not people that are looking at it to have a fight about it. They are saying, can we get real stuff done? Because if there's mercantilism in farming, if there's mercantilism in finance, if there's mercantilism in everything from, socks to underwear all the way up to the top of the chain, there's probably some mercantilism in medicine. Can we talk about it? That's what MAHA wanted to have the conversation about. And now it's like, it's the same thing that happens in Washington. The machine chews and spits everybody up, and you're ended up with just what you get.
Liz Hamill from KFF, you wanted to jump in.
Yeah, I just wanted to say a couple of things about sort of that soft support for what Kennedy is doing, even among MAHA supporters among the public. I think that also reflects the sort of broad appeal of the idea of MAHA and the fact that 4 in 10 Americans is not the cohesive group that maybe the hardcore MAHA supporters are. The other thing I want to say is the views of what is happening with vaccines. I want to put an asterisk on that, which is that in our polling, actually only about half of the public had even heard much about what was happening. And so I think those of us on this call are paying really close attention to this, and we might assume that everybody in the public is as well. But remember, a lot of people, younger people, are not even reading the news. Parents are busy, getting their kids off to school, putting food on the table. And so we may think that this is being driven by a deeply informed view of what has actually happened in terms of vaccine policy. But that is certainly not the case for most of the public.
Yeah, and just to pick up on what Aaron was saying as well, I know that you guys, KFF, had found that even among MAHA supporters, there's a 78% confidence in the polio vaccine, a 77% confidence in MMR, and that 75% of MAHA parents say they've kept their children up to date with recommended vaccines. So it's not always the caricature that we see, in social media. It's far from it.
Just to add to that, Tom, that, I'm finding more and more in our work that we're in this kind of multiple things can be true environment where you can both have 90% support for childhood vaccinations, as well as increasing hesitation for particular vaccines, or that, uptake is starting to go down in certain places, or that close to half the country is questioning vaccine safety and things like that. And also I'm just going to say this now, I have a room of pollsters that I'm craving much more granular kind of information on that both things can be true sort of perspective, because I think that people use the fact that the country is mostly supportive of vaccines to sort of ignore the population that is having questions, and that, things like younger parents are increasingly the group that is becoming vaccine hesitant. So I really crave that information. As we're winding down, I'd love to, Melissa, first ask you, what to you, particularly as it relates to MAHA, but also just a kind of a health conscious population, what are some of the key things that you are going to continue to watch? What are we going to see on the horizon as we're rounding the corner?
It's such a good question. We actually are grappling with this right now, and I think a concrete example is that next month we do 3 focus groups each month. We're gonna do all of our focus groups next month on healthcare, and so people that have opted out of insurance, that got their insurance through the ACA marketplace, and now have decided costs have gone up, I can't afford it, and to hear from them, to hear from caregivers, from doctors and nurses and healthcare workers, how are they experiencing and hearing from their patients, both broadly the healthcare system, and the problems that we're having with that, but also on a more granular level on costs. But I think to your point on people who are questioning a lot of healthcare issues, I'm also fascinated by that. So I think Navigator did a big deep dive into trying to better understand MAHA and this MAHA curious group that wouldn't consider themselves part of MAHA, that is I think more firmly aligned with kind of the MAGA movement and Trump supporters, but this group that, to your point, like holds different viewpoints and hears different information. Myself, I'm a parent of 2 young kids, and I feel like I'm bombarded, especially on social media, with so many different things that are pretty scary. Of, should my kids' lunch, should their little lunch container, does it have microplastics? Or, are the food, what we went back to earlier, is the food that I'm giving my kids, is it ultra processed? Like, is the food that we're actually giving our families safe for them to eat? So I'm really interested in especially the parent piece of it, parents that are getting all of this different information, and better understanding what are they the information that they are taking in, how are they assessing that, and what we found for this MAHA curious group is that they get multiple viewpoints. They'll still ask their doctor or a healthcare worker for their advice, but then they'll go on ChatGPT, or they'll Google it, or they'll go to influencer accounts that they trust, and take all of those different viewpoints and information and then make their own decision. So I'm just really interested in better understanding kind of that better understanding MAHA curious kind of parent population and the information that they're getting, and news consumption. We've done a lot, it was alluded to earlier, like a lot of people are telling us, we call them passive news consumers. They don't seek out the news comes to them. A lot of people I've heard over the last year with more frequency are actively avoiding the news. So matching up kind of those differing healthcare opinions and views that we are getting with news consumption, and just better understanding all of those different inputs and how it's shaping their views on healthcare.
Ashley from KFF, you had a thought.
I was really struck by this conversation around healthcare costs. And, as a background of being a health policy pollster, that worked during the COVID-19 pandemic to better understand outreach and views of the COVID-19 vaccine, and how important it is for individuals and families to have a relationship with a provider, right? So a trusted provider that they can have a conversation with, that can be part of their community. I'm thinking back to y'all's episode around the measles outbreaks in South Carolina and Texas, and talking to those providers and how important it was to have community-based providers for people with it that were really, vaccine hesitant and wanting to have those conversations. And if we tie that back to health costs, where we all started, the problem with increasing healthcare costs is people don't go to the doctor, and therefore don't have the relationship with those providers to be able to ask these questions about food safety, about how to take care of their kids, about whether or not their child should get vaccinated. It's not going to come from media. It's not going to come from TikTok. It's going to be having those conversations with providers. And if people can't afford to get healthcare, who are they going to go to? They're going to rely on TikTokers that don't have their best interests at heart.
Thank you,
I wish you all
Ashley.
could see Brenda reacting to that.
That was just, if I could just scream amen to everything you just said. I mean, it's all so multifactorial, and I'm really glad you brought that episode up too, because I've been thinking a lot about that. Liz, from KFF, you had a thought.
Yeah, I just wanted to say, going back to both what Ashley said and what Melissa said, I think that where people are getting their health information going forward is what we really want to keep an eye on. We have a brand new poll out today showing that 1/3 of people said that they went to an AI chatbot for health or mental health information in the past year. And that's the same share that say that they're going to social media for health information. And again, much more common among younger people. And I do think in health, this is one of the trends that we really want to keep an eye on going forward.
Liz, can I admit something really fucked up? When I go to the doctor, and I went to the doctor recently, after my appointment, I went onto ChatGPT to like fact check my doctor.
So but
Isn't
I
that
think
screwed up?
But
That's screwed up, but I did
that
it.
you said there is you did that in conjunction with a doctor's appointment. What we're finding is that a lot of people are just going to Chat GPT, and then it's not after they've seen a doctor or not even before they're going to go to a doctor. They're not following up with a doctor at all. And maybe that's for some very benign issue and it's not a big deal. But we also know that these AI models can give bad advice sometimes, especially around mental health. And when we see people saying they're afraid to talk to a doctor, they don't have access to a doctor, and they're using this in place of seeking medical care, that's where I think we're going to see more and more problems with it.
Oy. So we began this conversation with the basic notion that about 3/4 of registered voters say healthcare costs will impact their midterm vote. There's another number from you guys, KFF, that says the percentage of Americans who have none or not too much confidence to address the cost of living issues. When it comes to President Trump, that's 62% of the likely voters feel they either have none or not too much confidence that he can address the cost of living issue. For Democrats in Congress, it's 63% that they don't have much confidence that they can address this issue. And for Republicans in Congress, it's 64% that they don't have much confidence that they can fix this issue. Where does that leave us? Like, the confidence levels that either party in Congress or the president can fix this central issue, that is both depressing, but also maybe an opportunity for someone like a Kennedy, an alternative candidate, or a third party. I mean, are we finally tipping to there could be room for someone to make a serious run from outside of our two-party system? I mean, I'll just toss it around. Ashley, just what do you make of that?
Ashley's like, don't
No
come
pressure.
to me. Ashley, we're going to you.
What do you make of that number, those numbers?
I think it's totally reflective of the conversation we've been having here, right? I mean, what we have repeatedly pointed out from the pollsters and from Aaron is that there is bipartisan lack of confidence in Congress to take on the public's number one issue. The public can agree this is their number one issue, and they don't trust members of Congress or the president to fix it. And so where do we go from here? I am not a strategist, so I can't say whether or not like an outside influence or outside politician could take on this issue. But I do think there is an opening for something, and the public is desperate for it a little bit, right? The public is really a yearning for someone. I mean, it's realistic to bring down healthcare costs is not, it's curbing healthcare costs. It's making so that they don't continue to increase so high that people are having to make those decisions about being able to afford groceries for their family or go to the doctor. And so that seems like a right place for someone to come in. But I don't know who that is or what their platform would really be.
Liz, you want to jump in?
Yeah, I was just going to say, I think the more immediate implication for this midterm election is that if people are frustrated about the cost of living and they don't see anybody doing anything to address it, they're just going to stay home. Like, I think it really does have implications for turnout in the election. If people aren't seeing anyone address the issues that are important to them, then they're not going to bother to go out and vote.
Melissa?
Sure. What I would add too is we have research from Navigator that from last year where we asked Americans about our political and economic system. And 3 in 5 Americans think our system needs major changes. That's across Republicans, Democrats, and independents. And so I think, as others have said, I think their lane is wide open for someone that offers an alternative to what they're seeing because they are so frustrated with the current system. And I think what we also hear from focus groups is give us something to vote for. They just want, I think it was Aaron who alluded to earlier, like some people feel like they're just constantly choosing like the best, worst option. Like they want something that they can vote proactively for that they feel like will make their lives better and not just either vote against something or feel like you have no good options and just stay home.
Aaron, last word to you.
Take us home, Aaron.
Well, I think it speaks to the fact that the whole thing is too big. I mean, I don't know that you're going to get 350 million people to try to figure out how to solve this problem for 350 million people. I mean, I don't know. I don't know what that solution is. I mean, I consistently say that I'm not sure how dedicated we have to be to keep 50 stars on a flag. Why couldn't it be 200? Why couldn't it be bigger than that to get more representation? They're woefully underrepresented. I mean, each representative now is like 750,000 people. One representative person represents 750,000 people. The Constitution had it somewhere pegged between 20 and 40,000 persons per district. That was the idea of what representation was. We're not there. We've got this massive thing, and I'm not sure that you're going to figure out how to solve it through the voting system. Will you have the opportunity to get a third party? Again, fear motivates all of that. People are like, but what if my third party person means that the guy that I didn't want gets in? It's kind of calculated chess nonsense that everybody does. Fear motivates the whole thing. We saw it all the way through the Kennedy campaign. You couldn't get people to come off of that. So I don't know. Maybe it is. Maybe people get finally fed up with it, finally say enough is enough is enough. We're going to go the Jesse Ventura model in Minnesota and try to vote for somebody that's totally on the outside, totally outside of this deal. But I don't know. Like to Ashley's point about, look, the districts are set up to keep themselves insulated. It's all drawn so that they never lose. That system's not tenable. And I'm not going to continue to advocate that we fix it within the system. I don't know that it's doable. And I don't know that a third party, maybe it could do some disruption, but I'm not sure that we're going to get there. And if that's the case, then the American people need a different voice. And that voice may have to just be a totally re-examination of everything we have on the table. And, from healthcare all the way up to, a magic piece of paper that was written 200 and some odd years ago that everybody seems to think is going to hold this whole thing together.
So when we started this episode, we said we're not having a pool party, we're having a poll party. And I was imagining like blown up beach balls and little drinks with umbrellas in them and maybe some like
chips and
like 90s hip hop playing in the background. But instead, we're having some really difficult conversations. I'm going to tell you, this was like, it was a eye-opening conversation. What I love is y'all just put it all out there. And these are things that we as a public just have to wrestle with. This is how we feel. I hope you guys continue to ask us questions and ask us how we feel. And more than anything, ask us how we behave, because I think that can often be even more indicative of where we stand on these things. So I want to give a big thank you to Melissa Tufanian from Navigator Research, Liz Hamill from KFF, Ashley Kurzinger from KFF, and Aaron Everett, our dear friend who's been on the pod multiple times. Thank you all for coming on to Why Should I Trust You?
Absolutely.
Thank you so much.
It was a pleasure.
Had a great time.
That is our episode for this week. Please send questions and comments to questions@whyshoulditrustyou.net. Please leave a rate, a like, a review, sign up for our Substack. Maybe send us your favorite pool party cocktail recipes. Poll party. I like that joke, you guys.
I love it. Should we do that this summer, B?
Yeah, let's do it. Let's do poll party cocktails. I am Brenda Adhikari. He's Tom Johnson. She's Maggie Bartlett. Mark will be back soon. And that was Why Should I Trust You? Thank you. Join us again next week.